Rep Slater, I'm sorry, Vice Chair Slater.
Chairman, just a quick comment because I talked to Representative Morgan about this, and I've been by to see the Rhode Island Free Clinic a number of times. So they do amazing work, and I'm glad you submitted this legislation. So hopefully, with some of the money that we've got, the federal money and other things, I hope maybe there's some grants existing in the health department that we could get this funding.
I hope so. I hope you can squeeze something out for them.
Thank you.
Okay, thank you very much for your testimony.
Thank you.
Okay. Okay, great. We've got, is he out on the line? Is Rep Place on the screen? Okay, if you can get him to come down now, that would be great. All right, then we will go to Rep Slater has a bill on. You do. You're up. Bill 5809.
No. Thank you, Chairman. This is a bill I've put in for a number of years now, and I think hopefully this year's the year. It's a great bill. It's the Home Energy Rate Affordability Act, PIP, Percentage of Income Payment Plan. It creates a PIP program to be for Home Energy Rate Affordability Program to ensure utility service is affordable for low-income households and can help alleviate the shutoff crisis in Rhode Island. Creates the Home Energy Rate Affordability Program eligible to households at or below 150% of the federal poverty level who are enrolled in LIHEAP, Low Income Home Energy Assistance Program. It reduces the eligible household's energy burden to an affordable percentage of income. Affordability and credits to consumers' utility bills determined using several tiers based on income level and type of energy use, with the affordable energy burden ranging from 2% to 4% of a household's gross annual income. The program funds may also be used for household utility crisis intervention, and with utility customers encouraged to enroll in existing arrearage management programs if applicable. Maximum energy usage eligible for the program limit based on household side condition of dwelling and average Rhode Island household energy use, with limit no lower than 150% of median Rhode Island household energy use. Conservation may be rewarded with reduction in percentage payment required, and it's funded through a monthly charge to all gas and electric accounts, $1.55 a month for residential gas and electric accounts, including low-income households, and tiered charges for commercial and industrial utility accounts based on energy usage. The program funded for 3 years based on initial monthly charges, subsequently funded by sufficient monthly charges to be set by the Rhode Island Public Utilities Commission annually. Establishes a dedicated rate affordability account operated by independent nonprofit trustee with funds provided on a first-come, first-served basis, as long as funds are available, with the funds to be fully expended annually. Administered through the Department of Human Resources, who already coordinates the cap and gather the same information for LIHEAP eligibility that is required for the program. Annual reports and evaluation after 3 years assesses the program. I think a lot of you will have handouts, and there's others that will testify about this program and the help that it will give. But basically, Rhode Islanders under the poverty line pay 44% of their income to utilities. Under the PIP, people pay a fixed percentage of their income for utilities. We aim to decrease this percentage to 2 to 4% of a household's income. And why? Over a dozen states, including Ohio, New Jersey, and Maine, have successful PIPs. In Illinois, PIP lowered 90% of elderly customers' heating bills. It benefits everyone. Low-income families could save over $800 every year. And the reality is, a lot of times when people can't afford to pay their utility bills. They go into arrearage, and some of them don't get paid. And we end up taking on those uncollectibles anyway through our payments, and they get included in our rate. So I think this would be a great program. I'm supported for many years by the George Wiley Center. I've been working with them, and I thank you. I'm happy to take any questions, but I'm sure there's a lot of other people that will be testifying.
Yeah, you got 112. No, not that many tonight. Thank you so much for you introducing the bill. Any questions of the sponsor of that bill at this moment, please?
Barros.
I see Rep. Barros.
Thank you, Chairman. And I have to say thanks again for his dogged attitude towards this program. And it's a wonderful program, and I think a lot of folks in my district would benefit from it. And I support the bill. So, Rep. Slater, so the fiscal impact, I mean, I think the first question would be, how does, the PUC have reacted to this? And then the other thing is, what would be the fiscal impact and who would be paying for this?
So, Representative Barros, this would be paid for on a charge on the utility bills. It would come from ratepayers, basically, and so the state revenues and state expenditures would be zero for this program. But the bill is created to ensure that utilities are affordable for low-income households, and the act would require that utility companies collect a monthly charge from all gas and electric accounts, and the utility companies use the funds to apply the subsidy credits to gas and electric accounts for qualifying low-income households, such as qualifying households pay a fixed percentage. So, but it would have no impact on public funds, and all the funds necessary to run the program, which subsidized through customer credits, would be collected, administered, and dispersed by the private utility companies.
So, yeah, I mean, I think it's a wonderful program. I think you and I would certainly be ready to, to pony up whatever percentage. So what percentage, I mean, in terms of what would my household gas bill and electric bill go up by what percentage rate? What additional percentage amount, 1%, 5%, whatever? Can you tell me a little bit about that?
Yes, Representative, 1 second. So I think it would be about $1.55 initially, and then after that, the program, there'd have to be, more study and evaluation of how much the program costs, and that would be determined on a go-forward basis.
A small cost to help those of us who are, most in need. Thank you very much, Chairman and Rep. Slater.
Thank you for the bill and for the question. Are there any more questions of the sponsor of the bill, please? Okay, if not, thank you very much for that. Rep. Place, please.
Thank you, Mr. Chairman. I'm glad to see you guys put in the booster seat back here for those testifying. If we hadn't been down here, we'd really get caught up really quick. I'm here to introduce House Bill 5848. What this, in essence, is here what I'm asking this committee to consider is allowing allowing Medicare and Medicaid billing for local community paramedic services. Right now, we have a program in Burrillville that's operated by the Pasco Fire District that teams with the Well One, and what it offers is our paramedics go into certain homes of certain at-risk individuals and provide just basic home health care needs, whether it be minor wound management, assisting somebody who has suffered from addiction in the past and is in treatment now, diabetic treatment, things of that nature, identifying people that may not need to go to an emergency room, but may need instead to be teamed up with a physician. And this program is ongoing now. It's being funded by a grant from the Champlain Foundation, and it's doing really good work in the community. The legislation itself is based off of a model from Minnesota, but there are comparable programs, I believe, in California as well. And again, the idea is allow our local EMS folks to make home visits and to check on, say, shut-ins, other elderly and folks that just don't necessarily have access or regular access to good quality health care.
Thank you. Are there any questions of the sponsor for that particular bill, please? Checking. Rep. Barros?
Thank you, Mr. Chairman. Rep. Place, so if I hear you correctly, this would probably be most useful to the folks in the suburban areas.
I'd probably disagree with you, Representative. I think as long as your municipal fire departments and EMS services are willing to stand up and provide this service, it's something they can definitely do. But if you look at the legislation, it also allows a wide variety of healthcare workers to provide this service. It's just that right now we just don't authorize it through our billing system. So even local community groups could find volunteer medical professionals to go into their communities and provide the exact same care. It just so happens the model is a local fire district with one of our, with some of our union firefighters doing it right now. It could be, if you look at the legislation, again, it's quite expansive, whether it be doctors, nurses, and other medical professionals as well. It doesn't necessarily restrict it to just EMS. It's more about the type of care that's being provided and where it's being provided. And the goal being to prevent unnecessary trips to emergency rooms, whether through preventative care or by just ensuring, by seeing it. Like they go in and they see it, they know, okay, look, we don't have to transport you to the emergency room in order to provide care. We can still bill for it if we just treat you right here. As it is right now, if they just treat somebody or refer them to a doctor, they're not getting billed. They can't bill for that. So in order to get billed for the service, so if an EMS unit shows up, or say a nurse or another medical professional goes into, say, a shut-in's house, and they recognize that this shut-in doesn't necessarily need to be transported to the emergency room, a lot of times they're still going to transport that person in order to get the billing for the hours and the equipment and the supplies that they've used to treat that person. So what this would allow is it would avoid unnecessary trips to the emergency room, both by identifying the fact that it's not necessary and allow them to bill for that small amount of care that they do within the home, and also by continuing care of, again, say someone who had had post-op or something like that, wound care, and potentially for, say, diabetes treatments. You've got some old timers that are just stubborn. They don't want to necessarily go to their doctors on a regular basis, but these teams show up into the communities. They can go right up to that old timer and explain to them, hey, look, you need to check your diabetes this way. This old timer isn't necessarily finding themselves in a situation where they're all of a sudden finding sepsis in the person's foot, and that's when they're actually bringing them to the emergency room.
I appreciate the explanation. I think I understood it to just mean that it was just the EMS folks, but I thank you for the explanation. Thank you, Chairman.
Well, yeah, my apologies, Representative. Again, the origin of the bill was EMS, because that's the way we're working it. Because in the state of Rhode Island, we don't have a specific way to qualify EMS providers of this service. If you look to, again, I think Minnesota as the model, they actually have a specific qualification for their EMS. So working with the Legislative Council, we made the decision to broaden it as much as possible so that a myriad of different medical professionals could make use of the service and provide that service to our communities, both rural, suburban, and urban.
Thank you, Representative. Thank you very much for the explanation. Thank you, Chairman.
Thank you very much for the comment and for the introduction of the bill. Any other questions of the sponsor, please? If not, thank you very much. We appreciate that.
Thank you, Mr. Chairman. I want to fix this chair.
We'll get it fixed. Okay. The next bill we hear is Bill 6255 by Rep. Vella Wilkinson.
Thank you very much, Mr. Chairman. Ladies and gentlemen of the Finance Committee, about a month ago, we heard a bill regarding the Rhode Island Works program and a discussion involving eligibility and eligible income for the Rhode Island Works program. One of the categories included veterans benefits, But unfortunately, the category of veterans benefits did not include an exemption for disability pension pay, and it should have for a very good reason. The VA, the IRS also exempts disability pay because it's not a bonus. It's actually the government's attempt to make the veteran whole after having sustained a disability following service for the country. And so for that reason, I believe that disability pensions should not be considered as a pension when determining the eligibility for the Rhode Island Works program either. And so that's what this bill would attempt to do. It would just add that in the column where it says veterans benefits, it would say except for disability pensions. That's it in a nutshell.
Thank you so much for that, Bill. Are there any questions of the sponsor on that, please? Rep. Barros?
Thank you, Chairman, and Rep. Villa Wilkinson, because she's definitely a spokesperson for the folks who serve our country. So, Rep, so PTSD would fall under that disability as well?
Thank you for the question, Rep. Barros. If the veteran was diagnosed with PTSD as a result of, for instance, military sexual trauma or some other trauma that may have been sustained in a combat area, if the individual is given a rating by the VA and follow-on disability pay, yes, that would be included.
Thank you, Rep. Thank you, Chairman.
You are quite welcome. Thank you very much for that. Okay, I have, I want to check with my clerk. I have Bill 6035 by Whip Kazarian. Is she? Okay, thank you very much. So, House Bill 6035 by Whip Kazarian. This act requires health insurers to provide coverage for all FDA-approved contraceptive drugs, devices, and other products. So I've read that into the record, and if anyone has any questions on that, you can, contact Whip Kazarian to get an explanation of that. Any questions from anyone? I'm looking at it on my screen. Okay, good. So that ends that. And now I just want to double check with my clerk. Yeah, with Rep. Barros. I have to double check everything. I've X'd off most of the bills I have. Did I miss any bills that, Mr. Carter, did I miss any bills? I think so. Okay. So now what we'll do, this is the exciting part of what we do every night. We have a large number of guests that have been waiting patient, and I thank you for that, for the phones. When you're, and I'm going to call the names of those who signed up on the bills that have the least number of people. So if we have to go over and come back, we'll keep the same groups of people together. So I think that works well. But at any rate, remember when I was telling you that if you call in, please be brief, be concise. I know that we have a lot of professionals who are there, but we always take a lot of written testimony, and we have most of your written testimony anyway. But if you wanted to make 2 or 3 points about your testimony, that's fine. But we are keeping these remarks under 2 minutes or under. So please be reminded of that. You should hear a sound that will let you know that we're very near the 2 minutes that you have to do that, or less than 2 minutes in most cases. I hope that's so we can get everyone in. And if you don't hear it and you hear one of us, myself or one of the vice chairs interrupt you, it's not being rude, but it just let you know that it's time to go on to the next one. I will try to keep you abreast of where we are in terms of how many more are left. So if you think you're way down the line or something, you may or may not want to stay on, but hope you do. But in any case, we're going to start calling in just a moment, but we're going to be very brief when we do. Okay? Ready? Welcome. You're on House Finance. You have less than.
Hello, Mr.
Good.
Mr.
You have
Chairman?
good. You have less than a couple of minutes to give us your name and testimony. I can hear you well, sir.
Fine. Yes, this is Bill Flynn from the Senior Agenda Coalition, And I'm here in support of two bills, Mr. Chairman, that I'll do simultaneously because my 5542, but also 5790. Basically, both of these provide badly needed assistance to a large population of seniors, which some have called the forgotten middle. These are seniors just above the income levels for two programs designed to help them cover their health care costs, and yet they lack sufficient. Many of them lack sufficient savings and income to pay out of pocket. And a national survey found and estimated that there are nationwide 14 million seniors 75 and over have lower savings, less likely to have pensions, and struggle to pay housing costs, as well as they average $5,000 out-of-pocket health care premiums. And lastly, the statewide planning estimates that by 2025, Rhode Island's population of seniors between 74 and 84 will increase by 16,000 persons from 2020 to 2025. This is a really large number of people. And as Representative Tansey said so well, these measures of poverty are so low that raising eligibility for these programs in one case to 185%, and the other for Medicaid from 100 to 133%, these are still people that are not well off at all and would benefit from this help. And lastly, these are programs that are administratively easy to manage and would really make a difference in the forgotten middle of seniors. Thank you.
Thank you, Bill. That was perfect. Nice and succinct. Thank you very much. Have a good night.
You're welcome.
Next witness. Hello, you are live with House Finance. If you could just introduce yourself and then speak briefly, just for a couple of minutes, about which particular bill you are here to testify on. Go right ahead.
Certainly, thank you. My name is Craig O'Connor. I'm the Director of Policy and Government Relations for Planned Parenthood of Southern New England. I'm here to speak in strong support of House Bill 6035 by Representative Kazarian. This legislation would build on the existing mandate Rhode Island has in place around commercial health insurance covering all forms of contraception. Under the ACA, contraception is considered a preventive health care service and so does not have any cost sharing, so no co-pays. This bill would preserve that in Rhode Island law, so it wouldn't create something new. It would just make sure that if something happened to the Affordable Care Act, this important provision would be retained in Rhode Island law. I've submitted written testimony. I just want to make two quick points. The first is that though the Trump administration is no longer in power, and they had a long record of attacking access to reproductive health care, the threat is not over. There are court cases going through the pipeline, and some even before the Supreme Court. And so Rhode Island needs to act now to protect access to contraception before any of those cases undo the gains that were made under the Affordable Care Act. And the second is simply to point out that the cost of some of the most effective forms of contraception, such as types of IUDs, can be very expensive. And we need to protect access for everyone in the state by ensuring that cost sharing and co-pays do not return as a barrier to accessing contraception. I think I heard the buzzer, so I'm going to stop now, and I'd be happy to answer questions.
Perfect. Thank you very much. Any questions for Craig? No questions. Thank you very much. Have a good night.
Thank you, Chair.
Next witness. Hello, welcome to House Finance. You are live. If you could just introduce yourself and then talk for a couple of minutes about the piece of legislation you are here to testify on. Go right ahead.
Yeah, sure. Thanks. Hello, my name's Kirk Robinson. I live at 11 Eagle Street in Providence. I'm testifying in support of three different bills tonight. I'm going to only talk about one of them in depth, though, for the sake of brevity. So the first bill I'm in support of is H. 5449, the audit of Medicaid programs administered by MCOs. Thank you, Rep. McGaugh, for that. It's a really good idea. I'm also testifying in support of 5628, Medicare for All. I'll say more about that one in a second. I'm also testifying in support of 6073 rent cancellation relief. That is also a very good bill, and thanks to the sponsors. But I want to talk more mostly about 5628, sponsored by Morales. It's an excellent bill. For me, healthcare is a human right. The United Kingdom and Canada can do it. Why can't the United States? And why not start in Rhode Island? If I could just, because I follow the activities of the GA fairly closely, so if I could just contrast this bill, the Medicare for All bill, with the recently passed LaSalle tax break, what I would say is that the latter is something that actually materially helps very few people. Like really, the people who are helped by that bill are the people who are very well connected. So for every person who's materially helped by the LaSalle bill, H 5628 helps 100,000 people. So literally, it would change and extend the lives of thousands of Rhode Islanders, and it really should be a no-brainer. So I wholeheartedly support this and would urge the committee to allow for it to come to a full committee vote. I understand you oftentimes have to hold things for further study, but, I think also this is quickly becoming like this code for killing a bill or whatever, and I think people are starting to get frustrated by that. So, please let 5628 go to a full committee vote. It's the right thing to do, and, Rhode Island can be a leader here and can really help working people, which I think we need. So,
awesome.
Yeah,
I appreciate that. I appreciate the testimony. Have a good night.
You too.
Next witness. Hello, you are live with House Finance. If you could just introduce yourself and then speak briefly about the particular piece of legislation you are here to testify on. Go right ahead.
Thank you so much. Thank you very much, Chairman Abney and members of the committee. My name is Lori Marie Peixoto, and I'm the Executive Director of the Mental Health Association of Rhode Island. We are a consumer advocacy nonprofit organization. We fully support this legislation, and we consider this piece of legislation to be the most important mental health legislation of 2021. We are so grateful to Representative Tansey for introducing this. And more than anything, I want to thank Representative Tansey for her open-hearted testimony. It really does take courage to talk about one's personal experience with a mental health condition, but that is exactly how we end stigma and discrimination. So thank you so much. As many of you know, I approached this work as a mental health consumer. Last summer, at the start of the pandemic, I started to feel symptoms of clinical depression, and I consulted my provider directory, and I could not find an in-network psychiatrist who could see me. So after calling lots of psychiatrists in my insurance plans network and not being able to get an appointment any sooner than 6 months out, I gave up and I consulted my primary care doctor for a prescription medication. This is not ideal. If my condition were more complicated, if it were my first experience with mental illness, or if I had 2 or more mental illnesses, then a primary care doc would not have had the expertise to properly treat me. In Rhode Island, as you've already heard, people with mental health conditions have tremendous difficulty finding in-network providers. I have been contacted by particularly people of color, people who speak English as a second language, who cannot find providers who look like them and share their culture and languages. People who have specific mental illnesses like eating disorders or PTSD or dissociative identity disorder have extreme difficulty in finding providers to specialize in their complicated conditions. We need this legislation. Anyone on this committee can access the Rhode Island Department of Health database of licensees, and you can look through that roster and you can start making phone calls and going down the list of all the mental health professionals that are licensed to practice in Rhode Island. And you will soon discover that many of these licensed providers are just not participating in insurance networks. They're not taking new patients even if they are in network, and many of them are booking several months out for new appointments. There are 2 reasons to pass this legislation.
You have 15
Number
seconds,
1,
please.
Okay, thank you, sir.
You're welcome.
Increasing access to outpatient treatment improves patient outcomes when you catch an illness early. And number 2, it will save money in the long term because it will cut down on utilization of emergency room departments, hospitals, and residential treatment. We are about to face a surge of people seeking treatment once the pandemic is over and people go out into the community again, and we just don't have enough providers to meet the demands of our population. Thank you so much, and I'm happy to answer any questions.
No, thank you for your testimony. We appreciate it. Okay.
Thank you so much. Have a great evening.
Have a great one yourself. Welcome. You're on House Finance. You've got less than 2 minutes to give us your name and testimony, please.
Okay, my name is Maureen Maigret. I'm speaking on behalf of the Aging and Community Subcommittee, and also Representative Jello asked me to provide some expert testimony. You've heard me previously talk about the difficult financial circumstances of so many of our older adults in Rhode Island and persons with disabilities. This evening, you've heard a lot about the issue of equity. The two bills I'm going to talk about really relate to economic equity and health affordability and equity. 5542 would expand the eligibility for the Medicare Premium Support Program, which pays for Part B premiums, which are $148.50 a month, and in some cases covers some co-payments and deductibles. This is just part of the cost that older adults on Medicare have to pay. And as my colleague Bill Flynn said, research shows that they could be paying up to $6,000 or more out of pocket for health care costs. What this bill does is very simple. It increases eligibility to 185% of the federal poverty level and eliminates the asset test. The federal government provides part of the funding for this and sets the eligibility floor. But the states can adjust those, and 12 states and D.C. have either no asset test or higher than the federal limit, including our New England states of Connecticut, Massachusetts, Vermont, and Maine. I included some written testimony that shows you a very detailed table of the various 3 levels of the program and what the income and asset limits are. With your permission, I'd like to go on to Bill 5790.
Yes, you have about another half minute or so go ahead, please.
Okay, this bill would expand eligibility for older adults and people with disability by increasing the eligibility income to 133% of the poverty level. So it would match most of the other people who are in Medicaid who go up to 133%. In addition, older adults and people with disabilities have an asset limit of either $4,000 for a single person or $6,000 for a couple. By allowing these people to participate in Medicaid, they will get some benefits that are not included in Medicare. So I would urge you to look at the economic straits of so many of our older adults and to think seriously about passing these bills that provide equity and justice for so many of our older persons. Thank you very much.
Thank you so much for your testimony. You're right on time. Thank you.
Hey, I did it.
You did it.
Thank you.
Okay, good. All right. Next guest, please. Welcome. You're on House Finance. You have less than 2 minutes to give us your name and testimony, so please proceed.
Thank you, Mr. Chairman. This is John Tassoni representing the Substance Use Mental Health Leadership Council. I'll keep it short and sweet. We agree with the piece of legislation that you have in front of you, and we support it wholeheartedly. And that's the end of my testimony, Mr. Chairman. I know you'll love it.
I love that you got that right, John. Thank you so much. It was very important. All right.
Thank you, Mr. Chairman. Thank you. Bye-bye.
You're welcome, sir. You're on House Finance. You have less than 2 minutes to give us your name and testimony. Please proceed.
Thank you, Mr. Chairman. My name is Katie Arona, and I am here on behalf of Rhode Island Kids Count to offer our strong support for House Bill 6075, which is sponsored by Rep. Williams. Currently, pregnant women with incomes up to $250 of the federal poverty level are eligible for Medicaid. However, 60 days after giving birth, these women can only stay enrolled in Medicaid if their income is at or below 141% of federal poverty. If it's above that, their health insurance through Medicaid ends after 60 days postpartum. What this means is that many women who give birth while on Medicaid are no longer eligible for Medicaid 60 days postpartum and must seek coverage elsewhere or risk becoming uninsured, which creates a gap in coverage. This compromises the continuity of care in the postpartum period, which is a critical time for both mom and baby. What's great about this bill is that there is federal money and federal support available to the state if the legislation is passed, thanks to the American Rescue Plan, which I detailed in my written testimony. I would also like to express our strong support for Bill 5157, which is the sugar sweetened beverage tax. We think that imposing a tax on sugar sweetened beverages and using this money to expand the SNAP incentive fund to promote healthy access and nutrition among SNAP recipients is a key strategy to promote the health and well-being of Rhode Island children and families and to address high levels of obesity among Rhode Island children. We urge you to pass both of these bills, and thank you for your time.
Thank you for your testimony. It was very important to us. Have a great evening and stay safe. Welcome, you're on House Finance. Please give us your name and testimony, and you have less than 2 minutes, please.
Thank you and good evening. I'm Christina Contreras-Fox, Senior Policy Analyst for the Rhode Island Coalition to End Homelessness. The coalition supports H5788 because it will help our state end chronic homelessness while realizing significant cost savings and improving service delivery. The Rhode Island Pay for Success Act will unlock about $1 million in federal funds and create 125 permanent supportive housing vouchers, the most effective intervention for chronic homelessness. Pay for Success is a kind of outcome-based funding where private companies provide the upfront capital to establish a social program. If the program demonstrates predefined outcomes, the government repays investors using a portion of the savings accrued. But if the program doesn't work, the private investor loses money. Government essentially only pays for the success achieved, hence Pay for Success. The model transfers risk from the public to the private sector while making a meaningful impact in communities. On any given night, 226 Rhode Islanders will experience chronic homelessness, and keys alone are not enough for them to achieve stability. Permanent supportive housing, which is housing plus community-based wraparound services and support, is the proven solution. Its evidence-base demonstrates significant increases in days housed, days not involved in the justice system, and even reduced Medicaid and emergency room use. 5788 creates 125 such vouchers targeted to chronically homeless Rhode Islanders who are also the highest utilizers of emergency services. At least $5.5 million is spent each year on said services trying to help folks get stably housed. Their chronic homelessness is on the rise. The Pay for Success Act could realize nearly $2 to $3 million in annual savings while providing the strongest path to stability possible for our most vulnerable neighbors. And other states have utilized this model to achieve the success that we hope to. As of February 2019, the Massachusetts Permanent Supportive Housing Pay for Success project has housed 807 base staters and served over 600 with community-based support services. But Rhode Island has a head start, Mass did not. HUD funding. We could unlock nearly $1 million in grant dollars for the project, yet if we don't act quickly, the feds will take our funding from us and redistribute it to another state. So before the committee has the opportunity to truly help our neighbors most in need, realize a better, more cost-efficient way to help people, and develop a policy blueprint for future successes impacting serious social challenges. But it starts with passage, and passage starts with your vote. So we urge you to give H5788 your full support. Thank you for the opportunity to testify before you tonight.
Thank you very much for your testimony. It's also very important for us. Thank you. Be safe. Next caller. Welcome, you're on House Finance. You have less than 2 minutes to give us your name and testimony on the bill. Please proceed.
Hi, my name is Victoria Pasinich. I'm testifying on House Bill 6075. Thank you, Chair Abney and the members of the committee for allowing me to speak. I think it's vital that postpartum women maintain Medicaid coverage through 12 months postpartum, and I'll tell you why. When I gave birth to my child, I quickly developed a severe case of postpartum depression that went untreated for the first 9 months of my child's life. And I was a very privileged person who had health insurance and access to a car and access to a psychiatrist to get the help, therapy, and medication I needed. And I don't know where I'd be without that. So it is vital that these women have coverage through 12 months postpartum. Do you know that the only time you're asked if you have postpartum depression is at your 6-week postpartum checkup, and by then they're only supposed to have 2 weeks to get medication, to get a psychiatrist? It's impossible. So that is why I'm speaking today, because postpartum depression is serious, and if we want healthy babies, we need healthy mommies. Thank you.
Thank you very much, and thanks for your help in helping us understand that. So keep speaking out, please.
Will do.
Welcome, you're on House Finance. You have less than 2 minutes, please, to give us your name and testimony. You can please proceed.
Yes, my name is Marie Gazal. I am the CEO of the Rhode Island Free Clinic, and I'm testifying on Bill H6234. Good evening. I have served as the CEO of the Rhode Island Free Clinic for the past 12 years. The clinic has a 23-year history of providing free, comprehensive, quality medical care to uninsured Rhode Islanders. And this is all done by dedicated volunteers, by community partners, and by our active fundraising. We rely 100% on donations and grants. We do not bill patients for any services, collect fees from patients, or receive any federal health center funding. In fact, we leverage every dollar that we raise 6 times. This means that for an operating budget of $1.2 million, we generate an additional $6 million in health services that are provided to our underserved patients. Care that prevents unnecessary emergency room visits, reduces our state's costs for uncompensated care, and provides access and health equity to our state's predominantly Hispanic, Black, and minority population. Our patients are those who fall through the cracks and who just cannot afford health care. We are often called the safety net for the safety net. We've served over 20,000 patients and have provided more than 100,000 medical and dental visits. In 2019, we opened a dental clinic, and this year, in 2020, we opened a statewide COVID test site for our minority population and are currently administering COVID vaccines. We've tested over 5,000 patients and have provided vaccine to over that amount as well. We are an organization that Rhode Island should be proud of, and we hope that we will have your support. Thank you.
Thank you very much for your inspiring testimony. We appreciate it.
Thank you.
Welcome. You're on House Finance. You have less than 2 minutes to give us your name and testimony, so please proceed.
Thank you, Chairman Abney. My name is Linda Katz. I'm the Policy Director at the Economic Progress Institute. I've submitted written testimony on 4 bills. I will briefly address them. The first 2 are ones that Maureen Maigret and Bill Flynn already spoke to. That's Rep. Tansy's Bill 5790. That would increase the Medicaid income limit for seniors and people with disabilities. Just as an example, what happens now is at age 64, the income limit for Medicaid is $1,481, but at age 65, it drops by $400 to $1,073. So this bill is designed to bring some equity in terms of access to Medicaid coverage. The second bill is 5542, Rep. Agello's bill, where we gave a very good description. This is just to cover the Medicare costs for very low-income seniors and people with disabilities. As she noted, Connecticut, Maine, Massachusetts all have higher income limits for this program. For example, in Rhode Island, the income limit is $1,074, and in Connecticut is $2,284. The next 2 bills I wanted to briefly address are bills that would improve access to health care for younger women. The first is Rep. Kassar's bill, 5787, that would provide for women enrolled in Medicaid to access abortion coverage. I'm expecting that will be covered since there are many people signed up on that. I'll just note that 16 states cover abortion through their Medicaid programs, including Connecticut, Massachusetts, and Maine. And the last bill that I wanted to address is Rep. Williams' Bill 6075, which Katie Arona just spoke to, that would provide Medicaid coverage for 12 months postpartum to women who are enrolled in Medicaid when they give birth. The Medicaid program needs to evolve with the research. The research is that women need health care services for 12 months postpartum, not just the 60 days that we currently provide. Thank you for hearing my testimony.
Thank you, Linda, for your impressive testimony. We really appreciate it and hope to see you again in person at some point soon. Take care. Welcome. You're on House Finance. You have less than 2 minutes, please, to give us your name and testimony. You may proceed.
Thank you. My name is Emily Boucher. I am a teacher and an artist and a member of the board of directors of the Woman Project. The Woman Project believes supporting the health and well-being of Black mamas is critically important for a more just and equitable future. I am here today to speak out in support of H6075, which ensures 12 months of postpartum coverage in Medicaid. Medicaid covers 1 in 5 women of reproductive age and helps make prenatal and delivery care accessible for nearly half of women giving birth. But the coverage cuts after 60 days after the birth of a child. The problem is that 1/3 of maternal deaths occur between 1 week to a year after childbirth, and Black women are 2 times more likely to die from prenatal-related cause than white women. Many factors contribute to this horrifying disparity, including chronic stress caused by racism, providers who fail to take Black women's health concerns seriously, and the lack of providers who come from communities of color. Fixing this will take a comprehensive and multi-pronged approach, but one significant factor that we can and must address quickly is the lack of health care safety net for postpartum women who receive health insurance from Medicaid. While access to insurance alone won't eliminate disparities in maternal health outcomes, insurance must be part of the overall solution. Medicaid has a role to play here, a significant role that can quickly leverage existing systems to provide needed health care in the postpartum period. Providing continued Medicare coverage helps ensure women not only recover from birth, but also have access to the ongoing care that they need and following giving birth. It can help mothers manage chronic conditions like hypertension and diabetes and provide access to behavioral health and other mental health care services. A 3-year study following 5,000 mothers found that 1 in 4 had elevated depressive symptoms at some point after giving birth, with roughly half of the group experiencing major depressive episodes during the postpartum period. A key recommendation coming out of the research was that to ensure that mothers be assessed and provided support on options multiple times early and late in the postpartum period when coverage is taken away after just a couple of months of the critical intervention currently. I'm finishing up now. Too often, families using Medicaid cannot simply afford the screening and care available, and so we need to expand the postpartum benefits, to prevent this from happening. I urge you all to support H6075, and I'm also asking you to support the 2 other very important bills to ensure maternal health and to address the gaps in access to health care. This is H5787 and H5709. Together, these 3 bills will make real strides to meet the needs of Rhode Islanders, reduce health disparities, and continue to advance economic recovery, which is dependent on the ability for people to care for themselves and their families. Please make these bills happen. They are common sense, and they are the right thing to do. I appreciate it so much, and I'm open for questions.
Thank you, Emily, for your testimony. Please stay safe.
Thank you.
Welcome. You are on House Finance. You have less than 2 minutes, please, to give us your name and testimony. You may proceed.
Thank you. My name is Robert Days. I'm the owner of Milestone Properties, LLC, out of Pawtucket. I strongly oppose House Bill 6073. I'm an educator and a landlord who's lived below my means in order to buy my first investment property, pay my taxes. I treat my residents with respect. I take pride in taking care of the place and keeping it clean and safe. As a small business owner and landlord, I strongly oppose this bill. It tries to strip the rights of property owners and basically enforces a de facto policy of rent control. I don't want federal or state handouts, nor do I want to be told to freeze my rents for 5 years while taxes and the cost of operating my properties continues to skyrocket. You cannot freeze my property taxes nor my utility costs for the next 5 years. Therefore, it is impossible to expect me to do the same with regards to increasing rent and expenses. Throughout the pandemic, small landlords like me have waived late fees, extended rent due dates, delayed eviction proceedings, and worked with our residents to allow them to stay in place healthy and secure. Many of us live alongside our residents. We share driveways, shovel walkways, bring in groceries, and have backyard barbecues. We suffer their losses, and we share their joys. Most landlords strive to avoid eviction. We do not recover anything in eviction, rarely. It's a massive expense to us. We avoid them at any cost. The legislature is effectively punishing landlords for the FX of the pandemic, and it's enacting bad policies that will result in fewer landlords renting to low-income tenants. Rhode Island continues to implement anti-landlord and anti-business legislation, and this is the latest example of legislative hostility toward the business community. I strongly oppose Bill 6073. Sincerely, Robert Days, Milestone Property. Thank you.
Thank you very much for your testimony. Stay safe, please.
You too. Bye now.
Bye-bye. Welcome. You're on House Finance. Could you turn your television or your radio down off, please?
Yep, I got it.
Okay, there you go. You're on House Finance, and you have less than 2 minutes, please, to give us your name and your testimony, and you can proceed.
Hi, my name's Steve Schratt. I oppose 6073. It seems like it'll hurt more than it help. I mean, mortgages are hard for the average person now, to get them, but I question if lenders will raise their fees and rates to cover the losses they will certainly take in from this. Are they going to not lend in the state anymore at all? I really question the legalities here. Can the state prohibit an entity from collecting a payment that is legally theirs? There's a big difference between a foreclosure moratorium and granting or even encouraging people to not pay their rent. I feel the bill would inspire a tenant to not pay their rent just because, whether they are out of work or not. Instead, we should be looking at creating something for people out of work during such a time that they can more readily find work, a program of some type, more than what we have now, temporarily even. We had a tattoo artist that we had given, he was out of work, and we had given him work doing graphic design, just doing the artistry work for the graphic design. It worked, helped him out. Things like that nature. I feel the scariest thing about this particular piece seems to, it's less than a just in case than more like, hey, what's next? When the next health emergency happens. It wasn't a virus that caused people to lose their jobs. It was the overreaction to it. If I were thinking ahead to try to prevent another repeat, it wouldn't be this bill. It would be drafting legislation to limit the governor's emergency executive powers. In this bill, there's people like me and the previous person that spoke. Even if you were to say, hey, you don't have to pay your mortgage, it's okay. I created this business. It's a business for me. It pays my insurance bill, my grocery bill, my gas bill, any of the necessities. To take that income from me, you don't have to pay your mortgage. That's not. It doesn't pan out. You know what I'm saying? And I think it's a bad piece of legislation. I do.
Okay, thank you for your testimony. We appreciate that, sir. And most of all, you stay safe.
Thanks.
You are on House Finance. You have less than 2 minutes, please, to give us your name and testimony. Please proceed.
My name is Connor Burbridge. I live at 17 Lee Street, Providence, Rhode Island, 02908. I might have a little bit of a different perspective than most people calling today. I work as a farmer, as a farmhand, and also I have a small business that's an agricultural business here in the state. And in regards to the bill in question, just wanted to include that it's hard to be a farmer. It's hard to run a farming business. Most farmers end up taking a loss in the United States, and one of the biggest overhead costs for farmers and farming businesses is health insurance. And so this bill would allow Rhode Island farmers to have better access to health insurance for their workers, and be able to focus more on what they want to do, which is growing food, fresh, healthy food for the communities here in Rhode Island. So I know we have a lot of great local farms here in this state, and I think this bill would be able to support them to continue what they need to do. That's all I had to say. Thank you.
Thank you very much. You said it well. We appreciate it. Stay safe. Welcome. You are on House Finance. You've got less than 2 minutes, please, to give us your name and your testimony, so please proceed.
Okay, thank you. My name is Mia Inoue, and I am calling to testify in support of a single-payer Medicare for all healthcare system. I think that the pandemic has really highlighted what we already knew, what we've known for a long time, which is that, we don't have a safety net for people in this country. And if you're rich, you can weather a storm like this past year. But if you're not, a lot of people end up going bankrupt or even dying just to cover their medical expenses when they have emergencies or when they're sick with COVID this year. And in my family, I have a sibling who had a serious mental health crisis, and because of he happened to be in between jobs at the time, and his health care was tied to his employment. He wasn't able to get access to therapy and to the medical care that he needed. He had to be in a treatment center, a residential treatment center, for a couple of weeks, and then he had to foot the bill when he got out. I just think that's really inhumane and it's unfair. And it's a basic right to have access to health care, and it's something that the government should prioritize. We really can't wait for a federal Medicare for all system. We need to do this now, and we can be a leader in Rhode Island and be a model of what's possible, and a more humane system for providing health care and taking care of all of our community members, and not just the people who have the most wealth. Thank you so much. I urge you to pass this bill.
Thank you so much for your testimony. Please stay safe.
Thank you, you too.
Welcome. You are on House Finance. You've got about 2 minutes, please, to give us your name and testimony, so you can please proceed.
I didn't mess up. No one's there.
I think we must have lost him.
The what? I did.
Could you? Hello, are you on the line, sir?
You have it on.
Okay, we'll try to reestablish a contact with this person. Welcome, you're on House Finance. Can you hear me now?
Yes, I can, Mr. Chairman. Bob Goldberg here for the Rhode Island Medical Transportation Association.
Good afternoon.
And, good afternoon, Mr. Chairman. I have submitted written testimony, but to remain in the time constraints, let me just indicate the Medical Transportation Association is association of ambulances that provide non-emergency medical transportation, such as people from a nursing home to a hospital, from a hospital to a nursing home, or medical appointments, things of that nature. 10 years ago, there were 11 such private ambulance companies in Rhode Island. Today, there's only 4 left due to the low reimbursement rates. The Medicaid reimbursement rates for ambulance transportation hasn't been raised in over 25 years. To summarize and simplify this bill would provide a floor through the Medicaid process as to how little private insurers could pay these ambulance runs that are very expensive to do. It's a somewhat complicated formula. I'm always available to any of the committee members or General Assembly members that wish to discuss this further, but the association unanimously supports this legislation, and they really need it to survive. And that's all I have at this time, Mr. Chairman. Thank you.
Well, thank you for your important testimony. Stay safe out there, please.
Likewise.
Okay.
Bye-bye.
Bye-bye. Welcome. You're on House Finance. You have less than 2 minutes, please, to give us your name and testimony. Please proceed.
Thank you for allowing me to speak on behalf of the Rhode Island Free Clinic for Bill 6234. My name is Caroline Troisi. I'm an internal medicine physician and have been volunteering at the Free Clinic since its beginning in 1999 and serving as medical director since 2001. The mission of the clinic is to provide medical care to Rhode Islanders who have no medical insurance. The patients we serve are the working poor. The Free Clinic is their medical home, and over the years we have been able to expand our services to provide comprehensive medical and preventive care to these individuals. It is the perfect example of the phrase, "It takes a village." We have been blessed by the support of our dedicated clinic staff, our committed board of directors, and many volunteers, which include medical personnel, doctors, specialists, dentists, nurses, medical residents. And what is especially gratifying is the participation of the whole community, hospitals, universities, local businesses, private citizens, and pharmacies, all working to keep the clinic open for business. In this year of COVID, the Rhode Island Free Clinic has been at the forefront of COVID testing and vaccinating. It takes a village, and that is why your support is so important to us. Everyone deserves medical care, and please help us to continue our work. Thank you.
Thank you very much for your testimony.
Thank you.
Mhm. Welcome. You're on House Finance. You have less than 2 minutes, please, to give us your name and testimony, so please proceed.
Sure. My name is Nick Hallstrom, and I'm here to give testimony on behalf of House Bill 5628 to establish a comprehensive single-payer health insurance program in the state of Rhode Island. I live in Cranston, Rhode Island, in the House District 18, and I'm also a proud member of the Providence Democratic Socialists of America. If we've learned anything from the pandemic, it's that the state and federal government in the wealthiest country in the world has the choice to provide essential health and human services for all of its citizens, regardless of their means or access to private health care. During the pandemic, for instance, coverage for COVID-19 was mandated free at the state and federal level. Choosing to remain the sole country in the developed world that does not offer universal health care is a political choice, and ordinary Americans are increasingly catching on. The time for Rhode Island state legislatures to serve the needs of its working class is now. So speaking personally, my income level and lack of employer-provided health care means I only qualify for the so-called affordable insurance policies that cost over $200 a month through HealthSource RI. I have a mental health disorder, and most treatments are not covered by this type of policy, forcing me to pay out of pocket on an annual income of around $25,000. I'm also in recovery from addiction and have many, many friends who have sought residential and inpatient treatment in moments of desperation and temporary clarity, only to find their health insurance policy won't cover more than a bare minimum 7 days in rehab, or worse yet, reject their claim outright. And many of these friends and others who have no health care frequently end up at the Salvation Army and other private religious-based rehabs that are already overloaded with people left behind by our broken healthcare system. So I know that my story is only one of thousands of Rhode Islanders who provide the labor that propels our economy forward, only to be left out in the cold when it comes to receiving even a minimum level of acceptable healthcare coverage. In fact, over 40,000 Rhode Islanders are currently uninsured. We already know that government-run programs like our federal VA programs cut down on bureaucracy and promote efficiency and cost control. House Bill 5628, no problem. House Bill 5628 would mean Rhode Island would be a leader in the kind of efficient and humane healthcare policy that a majority of Americans already believe our government must provide. I would like to close by noting that there's no serious administrative, logistic, legal, or fiscal obstacle to a statewide single-payer program in Rhode Island. The only question is whether there is the political will to become a leader in this country in passing a single-payer healthcare program for all of our residents. I respectfully urge you all to vote this out of committee into the House floor for a vote, and thank you for your time.
Thank you for your testimony, Nick. Stay safe, please.
Thank you. Have a
Welcome. You're on House Finance. You've got less than 2 minutes, please, to give us your name and testimony, and you can please proceed.
Okay, so my name is Marina Rodriguez, and I'm a physician in internal medicine. I have volunteered at the Free Clinic for many years, and since March of 2020, I started working there part-time when the clinic was basically closed due to the pandemic because they needed telephone services to provide help to our patients. The clinic depends totally on volunteers, and at that time, we didn't have anybody coming in, and services were basically shut down. This clinic provides free services to a population that either has no insurance or can't afford to buy it. And our services include not only primary care, which is obviously the most important, but there are specialties like cardiology, orthopedics, endocrinology, all volunteer doctors that come and give their services. This is all free, as well as the medications that we provide through a contract with CVS. Now, during the pandemic and now, when we're trying to rebuild the clinic, problems have not stopped for these patients, and we have diagnosed patients with significant diseases, with cancer, through this period of time because they obviously still need services. And as with other facilities, none of those needs have decreased. We have over 400 people waiting to be new patients. So this, and through the pandemic, we have been a testing site, a vaccination site for our community. So right now, we need help in increasing some of the staff to run the clinic, and certainly more providers, some of whom we may have to hire. So I just want to make the case for the service that this clinic provides to the community. These are working people. Is it over?
Yes, it is. That's your 2 minutes. If you need to end with another 15 or 20 seconds or so, that's okay.
So all I want to say is I just want to reinforce the value of the clinic to the community. And this is a working, mostly minority community. So thank you very much.
Thank you very much for your testimony. It's important to us. Stay safe, please.
Oh, God, I hope so. You too. Thank you.
Mm-hmm. Welcome. You're on House Finance. You have about 2 minutes, please, to give us your name and your testimony, so please proceed.
Thank you. My name is Daniel Kubismeyer. I'm the President and CEO of Thrive Behavioral Health. Thrive is the community mental health center for Kent County and a statewide provider of mental health services and services for the chronically homeless. We serve over 4,000 adults, children, and families annually. And about 1,000 of those are considered to be disabled, many severely. We're their safety net. We have a $22 million budget and 300 staff, and insurance billing makes up 64% of our budget. Staffing, 75% are expenses. And while this is typical of healthcare organizations, what's not typical is that because we provide mental health and substance abuse services, our rates of reimbursement have not gone up in 8 years, and even longer for some services. I repeat, 8 years. Despite talk of parity with medical care, it's not happening. Other expenses continue to rise. Just this past year, our employee health insurance rates went up 10%, a cost borne by both staff and the organization. And what's the impact of these stagnant rates? On staff, we haven't been able to give a salary increase for 8 years. 22% of my workforce makes less than $15 an hour, and unfortunately, but predictably, staff are going elsewhere. Just this past year, we lost 10% of our workforce, 31 staff, because of job dissatisfaction, because of salaries. I just lost 4 employees this past week alone. What's the impact on clients? Our business is all about building relationships between staff and clients, and the constant staff turnover is disheartening to some and devastating to others. As an organization, we're doing what we can to be smart about our spending. We're members of Horizon Healthcare Partners, an organization developed to share and reduce administrative costs. We're also one of 3 mental health centers to be part of an accountable care organization, whose purpose is to bring down the costs of health care. My point is we're being proactive to bring down our overhead and administrative costs, but there's only so much that can be done. After 8 years of no increases, we've wrung out all there is to save. We can't cut staff. Staff are needed to provide the services we are mandated to provide. The bottom line is 3/4 of our expenses, staff make up 3/4 of our expenses, and there's no more infrastructure to cut. I appeal to you to support this bill, not just for my staff, but for the clients they serve. It's worth repeating, we are the safety net for these clients, and the safety net is in serious danger of collapsing. Thank you.
Thank you very much for your testimony. It's important to us, sir. Stay safe. That's the next best thing. Okay.
Thank you.
You're welcome. Welcome. You're on House Finance. You've got less than 2 minutes to give us your name, testimony, so please proceed.
Thank you, Chairperson and committee members. My name is David Valise, and I'm the director of the Rhode Island Interfaith Coalition to Reduce Poverty, a coalition of faith leaders, advocates, congregations, and community residents who have come together to fight poverty and inequality. I'm also the Environmental Justice Chair of the Sierra Club. I mentioned that in respect to the first bill I was speaking about. I'm here tonight to support 2 bills, 5809, which would create a percentage of income payment plan for utilities, and 6075, which would increase postpartum Medicaid coverage for mothers across Rhode Island. First, for 5809, the fact is that we desperately need a percentage of income payment plan. Many Rhode Islanders struggle to pay utilities. Data has shown that Rhode Island has some of the highest rates in the country. This has devastating impacts on low-income Rhode Islanders. The pandemic has highlighted the need in our communities, and these choices have life and death impacts. During these times of distance learning and working from home, people are more and more using utilities. This comes at a cost that disproportionately impacts poor communities that already face increased food insecurity, housing insecurity, and joblessness. These insecurities and disparities are also the reasons why we support Bill 6075, which would increase postpartum benefits under Medicaid. Currently, women who qualify only get 2 months of coverage. This is not enough. Data shows that postpartum complications and even death often happen after a 2-month period. This bill would expand coverage for 12 months, a much-needed expansion to support mothers who shouldn't have a gap in coverage during this time. This would also start curbing health disparities for women of color. In Rhode Island, Black women are 83% more likely, and Hispanic and Latinx women are 34% more likely to experience severe complications at or after birth compared to their white counterparts. This extra coverage helps to provide crucial, sometimes life-saving care for children and mothers. We need this coverage. In closing, these legislations are about protecting the most vulnerable in our state. They are by prioritizing people. Throughout our collective faiths, we believe abundantly that we must support those in need, that we have a moral obligation to address disparities and inequality when we see it. So I implore you to pass these bills. Thank you to Rep. Williams and Rep. Slater for introducing these bills and for all of your time, and thank you in advance for supporting families in Rhode Island, and you all have a wonderful night.
Wait a minute.
Thank you so much for your testimony.
Thank you.
Good evening. Welcome. You're on House. Hello? Oh, hello?
Good evening.
Good evening. Hi.
Yep.
You're on House Finance. You have 2 minutes or less to testify. Please give your name and testimony. You can proceed. Thank you.
Thank you. My name is Dr. Herbert Rakitansky. I'm on the board of the Free Clinic. I'm a retired gastroenterologist, and I have been seeing patients at the Free Clinic for well over 10 years. I'm on the faculty at Brown, and I'm past president of the State Medical Society. This is comprehensive primary care, as I think all of us would like to get, and we don't even get it as good as we like. For example, we teach diabetics how to cook properly. We have on-site ophthalmologists for eye exams. We have on-site mental health counseling. We have access to medications from CVS. We serve a population that usually doesn't get any medical care. These people can't work because they're sick. By giving them proper medical care, we enable them to live with their families, be healthy, and basically provide a service that nobody else in our society does. So I urge all of you to take that into consideration and vote for this appropriation. Good health preserves families, enables people to hold jobs, take care of their kids, take care of their grandparents, and basically everything good to be said and nothing bad about this. Thank you very much.
Thank you so much for your testimony. You have a good evening.
Thank you.
Welcome. You're on House Finance. You have 2 minutes or less to give your name and testimony. You can proceed.
Thank you. Hello, my name is Dr. Mary McCabe. I'm a general dentist at the Rhode Island Free Clinic. I'd like to share our mission of the dental program, but first I'm going to ask a question. Have any of you ever had to extract your own tooth because you didn't have access to dental care? Have any of you ever lost a tooth eating from advanced periodontal disease, or had to wait 60 plus years for a cleaning? These are the scenarios I face every day at the Free Clinic, but luckily we're able to handle them clinically. We have state-of-the-art equipment. We have a wide variety of dental staff, dental hygienists, dental assistants, general dentist, periodontist, oral surgeon, But dentistry is very expensive. Before the pandemic, it was expensive. We have quite a few disposable items. Now, after the pandemic, it's extremely expensive. So your support is appreciated for our program. We work with medically fragile people, such as diabetics, people with immunocompromised illnesses. We have a patient-centered medical dental home where we work collaboratively with the physicians. So in closing and asking for your support, I'll just share a quick story. When I finished treatment with a patient recently, I told her, the treatment's done, you can come back in 6 months. And she was shocked. She thought it was a one-shot deal, that you just go to the dentist once and that's it. When I told her she could come back every 6 months, she said, I feel like I won the lottery. But actually, as a general dentist, I feel like I won the lottery for the opportunity to work there. So thank you for your support. We need it, and we provide an excellent quality service.
Doctor, thank you for your testimony and for all your great work for our citizens. We appreciate it.
You're welcome.
Thank you.
Thank you for hearing me out.
Have
you
a good
too.
night.
Bye-bye.
Good evening. You're on House Finance. You have 2 minutes or less to give your name and testimony, and you can proceed.
Thank you, Chairman Abney. It's Brian Bishop. I'm calling to testify especially on Bill 6073, the so-called rent cancellation bill. I think by its name alone, it should be obvious that perhaps this is a stalking horse for making America into Russia in 1917 without anybody actually shooting. I'm in favor of nobody shooting, but I think it's essentially a co-option of landowners' property. Unlike some of these bills, it actually does seem to, around the edges, to admit that, because it sort of tries to, although it doesn't explicitly say it's compensation, it tries to provide relief. The conditions for the relief and the difficulty in obtaining it and the time spent waiting for this would also be compensable as takings under this. And the bill even envisions that it's likely to be found unconstitutional. So I think as a stalking horse, we can all talk about what to do about more affordable housing, but as a bill, it's a very poor piece of legislation, and especially the very idea that you would cancel rent across the board. Figures are about perhaps 5% for people behind on their mortgages, which is encompassed in owner-occupied homes, which are prevented from foreclosure and have a mortgage payment holiday. And then the numbers are a little harder to grasp for renters, but even the highest numbers you will find is that 15 to 20% of people are behind on rent. This is obviously a very broad brush, which is not the way to go about this. And just as we've seen with many programs, that there's been no attempt to understand if people really needed the COVID eviction protections. Many people are receiving also many other programs that compensate for the loss of income that would have made it difficult for them to pay. I understand these are very difficult things to sort out, and I don't throw stones at anybody that needs help, but this is something that landlords provide as well as the state, and we'd like to work with you rather than feel like you're working against us, which is what it feels like this session.
Yeah.
Thank you very much.
Okay, thank you for your testimony, Brian. You have a good night. Thank you. Good evening. Welcome to House Finance. You have 2 minutes or less. Please give your name and testimony, and you can proceed.
Okay. Can you hear me?
Yes, you can go right ahead.
All right. Hello, everybody. First of all, thank you for giving me the opportunity. My name is Estefanos, and I have been a landlord for approximately 3 years now. My experience has been mostly good. Last year was the first time that I had, for a lack of a better word, a tenant from hell. And for the sake of privacy, I'll change his name and call him George. George was a construction worker and a recovering addict. Initially, George was good, but after a while, George went back to using drugs and had started smoking meth. He became intolerable to his fellow tenants and to myself. George was a hazard. For 1 year during the moratorium, I wasn't able to kick out George. I lost several months of rental income and lawyer fees. At one point, I reached out to Safe Harbor to request assistance for unpaid rent, and they told me I would have to agree to keep him for an additional 3 months. At that point, I decided no money would have been worth it to deal with George. I'd rather be broke than see George's face another day. Mind you, I have a 4-year-old son living downstairs, and he's a witness to all the nonsense George put us through. And today, I come here to testify against another egregious measure being proposed. In a state of emergency, if landlords seek help, they will have to agree to a 5-year freeze on rent. What landlord in his or her right mind will accept this? Just in the last 2 years, my home insurance policy has gone up by 10% year over year, and I haven't made any claims. My tax assessment has increased by 15%. Did you know that in Rhode Island, if we buy a mattress, there's a mattress fee that you pay? There's a 1% meal tax added when you eat fast food. In 2019, CNBC ranked Rhode Island as 50th in the best places to do business. That is last place in the United States. I just want to tell you, we already ranked the worst for businesses. Why are we passing another law that is not business-friendly, family-friendly? I urge you to reconsider. Thank you.
And thank you for your testimony, sir, and stay safe, please.
All right, thanks.
Welcome. You are on House Finance. You have 2 minutes or less to give us your name and testimony, so please proceed.
Thank you, Chairperson. I am Tiffany Bell, an OBGYN resident physician, speaking today on behalf of the American College of Obstetricians and Gynecologists, or ACOG. The Rhode Island section of ACOG represents more than 140 physicians and partners in women's health in our state. ACOG is the leading authority on women's health, committed to public policy based on facts and evidence-based medicine. Thank you for the opportunity to provide testimony in support of House Bill 6075 to extend Medicaid coverage to 12 months postpartum. As an OBGYN, I have the privilege of caring for women throughout their lives, including the special time related to their pregnancy and postpartum. Currently, Rhode Islanders with Medicaid insurance who give birth have full health coverage for only 60 days postpartum, which is simply not enough. This is especially true when we consider that in the United States, over 20% of maternal deaths occur between 6 weeks and 1 year postpartum, after their pregnancy-related Medicaid coverage has ended. We must focus on this period to prevent these deaths. I recently cared for a woman that a few days after delivering a healthy child developed heart failure called postpartum cardiomyopathy. This heart failure can develop between the last month of pregnancy and 5 months postpartum with no clear cause. When this patient was able to safely leave the hospital, her recovery was far from over. She continued to need to see many doctors and healthcare providers, take medications to protect her heart, and receive care, all of which would have been more difficult if she did not have full health care coverage, which was life-saving for her and many other patients. As you all are aware, there is currently a maternal mortality crisis in this country that we must tackle. In Rhode Island, Black women are 83% and Hispanic and Latinx women are 34% more likely to experience severe complications at or after birth compared to white women. Extending postpartum coverage in Rhode Island is one step to ensure that patients can access care and treatment for medical conditions and complications, transition to primary health providers, focus on preventive health care, all so that we can tackle the maternal mortality crisis in this country, increasing preventable maternal deaths and improving maternal health disparities. This is critical for promoting the long-term health and wellness of our patients, their mothers, their children, families, and communities. On behalf of the patients we serve, I, on behalf of ACOG, urge support of Bill 6075. Thank you, Chairperson and members.
Thank you for
Take
your
care.
testimony. We appreciate it. Stay safe, please.
Thank you.
Welcome. You're on House Finance. You have less than 2 minutes. Please give us your name and testimony, so please proceed.
Thank you so much. Chair Abney, you're absolutely wonderful for hearing us all this evening. My name is Gregory Waxmolsky. I'm here in District 64, represented by one of the best in the state. What we're hearing tonight is there should be no pause for consideration. There should be no pause for study. This Medicare for all that we're talking about is a necessity. Let me tell you why. When I was in my 20s, me, I'm out on a walk. When I was in my 20s, I was living in the UK. Now, as you know, in the United Kingdom, they have the National Health Service, the NHS. And I used to carouse back in my 20s. I'm much older now. And I woke up one day with a very painful, what later turned out to be a broken bone. I had never been to the NHS. I had been living there for years. I had never been into the hospital. I was lost to go to the hospital. Friends of mine dragged me in. They said, this doesn't look right. You shouldn't be doing that. It shouldn't be bending that way. You know, all that stuff. 3 days later, I got out of the hospital. They set me up. They fixed me up. It was just right. I remember waking up from surgery with two very capable-looking surgeons staring down over me. They said, you know, we got in there. It was a lot worse than we thought it was. It took twice as long as we thought it was going to. They struck me as extremely dedicated people. They said, we got you patched up. I said, guys, thank you so much. What do I owe you? They said, this is on the house. This is what National Health Service is. This is so you didn't stay out on the street and get all mended up in the wrong way. This is why we take care of each other in a socialist country like the United Kingdom. I was absolutely over the moon. I couldn't believe it. Obviously these surgeons could have been doing anything, but they were there to minister to me. If it's good enough for the National Health Service in the UK, where we get all of our best tricks, let's follow one. Let's do it. Let's not be the place where people have to choose between mountains of debt and their health and their well-being. We know that you're going to do the right thing by M4A out here at Rhode Island. Thank you so much for your time.
Thank you for your time, and glad it all worked out well for you. Take care of yourself.
Always does.
Stay safe.
Thank you. Have a good night.
Okay, have a good night. Welcome. You're on House Finance. You have less than 2 minutes, please, to give us your name, testimony, and please proceed.
Good evening, Mr. Chairman and members of the committee. My name is Shima Baran, and I'm an Associate Director at Social Finance, a national nonprofit and a global leader in outcomes-based funding and pay for success. I'm here to testify about Bill 5788, Rhode Island Pay for Success Act. Pay for Success helps shift government focus to outcomes rather than outputs. Government spends hundreds of billions of dollars each year to provide health and human services. However, for the most part, it measures outputs, such as the number of people served. Outputs do not provide answers to the big questions. Are we moving the needle on our intractable challenges like homelessness? Outcomes are what we're after, but evaluating, tracking, and reporting on outcomes requires investment in resources and a shift in mindset. Additionally, Pay for Success projects transfer performance risk from government to private funders. In this way, government can experiment with promising approaches for preventive programs or meaningfully scale a proven approach like permanent supportive housing, but it's obligated to pay only if the program works. Finally, Pay for Success can move us from compliance management to performance management by developing governance structures between providers, evaluators, and government staff to create rapid feedback loops and make data-driven decisions to improve program performance and spur innovation. Pay for Success sets up a win-win-win. Government gets accountability for taxpayer funds and only pays for outcomes achieved. Investors see financial returns alongside social ones. Effective nonprofits get flexible capital to scale, and together we can make progress on challenges that have plagued us for generations. Thank you for your time.
Thank you for your testimony. It's well appreciated. Stay safe out there, please.
Thank you.
Welcome. You're on House Finance. You have less than 2 minutes, please, to give us your name and testimony. Please proceed.
Yeah, hi, my name is Gregory Fox. I'm a pediatrician and the president of the Rhode Island Chapter of the American Academy of Pediatrics. I'm speaking on behalf of House Bill 6075, which extends Medicaid benefits for mothers up to 12 months, up from the current 60-day. And I just wanted to Thank you for hearing testimony on this bill and for all of the early childhood bills that have been put before you this year. This is part of a package to help support young babies and families. We know that the better babies do when they're in those first year or two, the more ready they are for kindergarten, the healthier they are for the rest of their lives. Specifically about this bill, in pediatrics, the health of the mom is very much tied to the health of the child. And extending Medicaid benefits from mom through a year is absolutely critical in our eyes. Just one specific example, which is something that we see a ton of in my field, is maternal depression. And, that's something that we screen for in my office as a regular screen at 1 month, 2 months, 4, 6, and 9 months, because it isn't something that is apparent right after a baby is born. And it's certainly not always apparent by that 60 days where the current Medicaid coverage is for moms. And so extending this allows us not only to, we're picking up moms regularly that are dealing with maternal depression, but being able to get them into services and to make sure that those services are paid for are critical. And so, this is something that we see as a very important step for early childhood. Moms that are depressed, they have a hard time bonding with their babies. Those babies sometimes are malnourished. Those babies have, developmental issues. And, we see this all the time in our practice where, just because a mom isn't able to, have payment for these services, they don't seek out services. So what do? They try to tackle it on their own. And in doing so, the babies suffer.
Another 30 seconds, Doc.
They fall off their growth charts. Yeah, and they fall off their growth charts, and we're left with, kind of bigger problems for later. And so, I think that this is a very important opportunity for us to help these moms out, and understanding that a disproportionate number of these moms are moms of color, are Hispanic and Black moms, will benefit from this law in a much greater numbers. And hopefully this is an opportunity for us to close the gap in care and give all of our kids an opportunity to succeed in that first year of life. So thank you very much for taking my testimony, and have a great night.
Have a great night yourself, Doc, and stay safe.
Thanks, you too. Take care.
Welcome, you're on House Finance. You have less than 2 minutes, please, to give your name and testimony, so please proceed.
Chairman Abney, Vice Chairs, and members of the committee, I'm Tanya Kubis-Meyer, Executive Director of the Rhode Island Coalition for Children and Families. I speak in strong support of House Bill 6268 to address the urgent need for behavioral health increases. My written testimony will follow. Rates drive provider capacity to respond to the needs of children, youth, and families in crisis. The Coalition's 38 members virtually all provide behavioral health care because the fundamental nature of work with children and families is therapeutic. We serve youth with mental health or substance abuse issues, youth in foster care and residential treatment, youth with autism spectrum disorders, youth in crisis due to domestic violence or sexual assault, youth in the juvenile justice system, and more. The cases members address are highly complex and require specialized expertise, and members need skilled staff and a workforce that is as diverse as the youth and families they serve. Rates drive a strong community system that helps keep children from hospitalization. Some 1,900 youth were hospitalized in 2019, and we know that with more robust community services, that number can come down. Without the right services, children also get stuck and stay in more intensive services longer than they should, again driving up cost. Despite member efforts to supplement rates, community-based programs are increasingly fragile, and addressing rates is the key issue. Just 3 of our members who provide outpatient and enhanced outpatient services lost some $840,000 in 2019. That's for 3. agencies. Raising rates alone won't address all the issues. There are underlying disparities between base rates for certain interventions. There's a need for consistent coverage. There's a need to address State Department rates and more, but those are matters for another day. I so thank you for the opportunity to speak and urge your support for 6268. Thank you.
Thank you very much for your testimony. Stay safe.
You too. Thank you.
Welcome. You're on House Finance. You have less than 2 minutes, please, to give us your name, testimony. You may proceed.
Chairman Abney, Bob Marshall, appearing on behalf of the Rhode Island Developmental Disabilities Council on two of Rep. Tansy's bills, 5790 and 5811. With regard to 5790, the Rhode Island Developmental Disabilities Council would like to commend Representative Tansy for her attempts through this bill to increase the income limit on Medicaid for seniors and individuals with disabilities. Both the significant number of elderly on low fixed incomes and the growing number of individuals with intellectual and developmental disabilities will have access for Medicaid and medical and dental coverage for this bill if it can pass. Thanks to the consent decree and the elimination of the sub-minimum wage, more adults with IDD are finding real jobs that pay some money and increase their income, but the limits are still low, and they need this assistance to help with their health care coverage. So we ask you to consider that in looking at 5790. With regard to 5811, Rhode Island Developmental Disability Council feels strongly that the participation of the EOHS and Buddha in the caseload estimating conferences will both enhance and secure the vital services provided by Buddha's Division of Developmental Disabilities to Rhode Island adults with intellectual and developmental disabilities. Sharing this information with the legislature prior to the development of state budgets, especially related to individuals transitioning from school to adult services, will avoid delays and gaps in the provision of services and budget overruns. Right now, the budget is done by comparing this year's proposed budget to last year's actual budget. This instead will look at how many services are needed and what it's going to cost to supply those services to the people that need them. We ask you to give a serious look to this to H5811. I'd be happy to take any questions and I'll submit written testimony.
Thank you very much for your testimony, sir. Stay safe. Welcome. You're on House Finance. You have less than 2 minutes, please, to give us your name and testimony, and you can proceed.
My name is Kate Shapiro. Thank you to the chair and to members of the committee. I and all these other people who are calling on you to move House Bill 5268 to the floor for a full vote are doing so because it seems clear that it will make everyone in Rhode Island healthier, safer, and able to live better lives, not just the people whose health care it will cover. I know that you've heard from and will hear more from people who have spoken about how single-payer health care would alleviate suffering, and that's enough of a reason to pass this bill and institute this program. I want to talk about some of the additional reasons. Because we think of illness as something that spreads, but health also spreads. And I'm going to give you some examples. My friend Jenna was hit by a car while riding her bike. She had health insurance through her job so she could go to physical therapy. That let her ride her bike again. That improved her physical and mental health overall, and that made her more patient with her kids. It also led to one less car's worth of traffic, which benefits everybody on the road, and one less car's worth of pollution, which benefits the health of everybody in the state. If someone's trying to leave an abusive relationship and their spouse is the one with the health care, either going or staying could end in suffering or even death for her or her kids. If anyone in Rhode Island can have health coverage, she can leave and she'll have more money to start a new life. This program could cover counseling for her and for the kids, setting them up to do better in their academic and their social lives with better possibilities for their future. Another friend, Zoe, is still young enough to have health care through their parents. This allows them to treat their mental illness consistently, which means instead of lying in bed feeling like death, they're able to leave their house, work a job, make art, and organize for their community. If more people had this kind of health care, they could contribute to their communities beyond struggling just to stay alive. A
CAT scan paid for by my work insurance revealed that the source of my husband's chest pain was a blood clot and probably saved his life. Doctors are already having trouble getting insurance companies to approve and pay for tests like CAT scans for patients who have long COVID or post-COVID complications, and we're going to be seeing more and more of this condition among our families and our neighbors in the coming months and years. If they can get tested for lung damage, blood clots, and other common after effects of COVID and get preventative care, they may be able to preserve their abilities to speak, move easily, and think clearly. Of course, that will make their working lives easier. And if they lose those abilities, the work they lose or the care they need will not bankrupt them. It also will not bankrupt and otherwise drain their families, cutting them off from their own professional growth, education, and parenting, or even from paying their rent.
Another
The Rhode
15
Island
seconds, please.
I'm just going to beg you then to move this bill out of study and bring it to the floor. Thank you.
Thank you for your testimony. It's very helpful. Stay safe. You're on House Finance. You have less than 2 minutes, please, to give us your name and testimony. You can please proceed.
Yes, my name is Terry Wright. I'm calling on behalf of DARE, Direct Action for Rights and Equality. I am the housing organizer. I just really want to start by saying thank you to Senate and committee members for allowing my testimony. This letter is in support of H6073. Really quick, DARE Tenant and Homeowners Association, we've been organizing low-income tenants and homeowners living in low-income, BIPOC, and marginalized communities since 2009 to prevent foreclosures and evictions and remediate unsafe housing conditions. Today, we are faced with another crisis, which is called evictions and foreclosures during a worldwide pandemic, which has caused an overbearance of housing instability and homelessness, and a debt by force, which will evade any type of economic progress for families who rent and own residential properties. Landlords are going bankrupt due to lack of income due to COVID-19, and evictions are continuing to happen despite a federal CDC, which is supposed to protect renters. In order to avoid an even larger crisis, we must act and enact. We are simply trying to prevent a full-blown crisis on top of the current housing crisis. It's very unfortunate that the world has been plagued with COVID, and no one should ever have to face housing insecurity, especially during a worldwide pandemic. Working families should not have to choose between food and the weight of mortgage, medicine, and rent payments. No one should. Safety first. It is evident that homelessness will grow and prevent Rhode Island from moving forward towards any type of economic recovery, which will create an environmental health crisis, which will continue to keep communities at the center of health hazards if we do not graciously pass H6073.
Thank you for your testimony. We appreciate it. You're on House Finance. You have less than 2 minutes, please, to give us your name and testimony. Please proceed.
Good evening, everyone. My name is Amy Nunn, and I'm Executive Director of the Rhode Island Public Health Institute. I am also a Professor of Public Health and Medicine at Brown University, and I hold master's and doctoral degrees from the Harvard School of Public Health. I've dedicated my career to advancing public health in Rhode Island. Our mission is to reduce health disparities in Rhode Island and beyond. And today I'm pleased to be here to be leading a diverse coalition of many different advocates from around the state in support of House Bill 5717. This bill would address hunger, which is at a record high in Rhode Island. And we are together advocating for a retail SNAP incentive that would provide subsidies for fruits and vegetables for individuals who shop with SNAP in the state of Rhode Island. Our diverse coalition includes organizations like the Rhode Island Foundation, Progreso Latino, the Rhode Island Medical Society, several cities, the Rhode Island Health Equity Zones, Family Services of Rhode Island, and Urban Greens Co-op Market, to include a few. We oversee one of the few SNAP incentive programs in the state. A SNAP incentive program is a program that doubles the value of produce for people when they shop with EBT or SNAP. We know from our own program, which serves about 5,000 people across the state, that this is a highly effective way to address hunger and to promote healthy eating. We have built the scientific evidence base for that program, and our intention with this bill is to expand a similar program into retail settings across the state where most people shop, like conventional grocery stores. There are approximately 180,000 SNAP users in the state of Rhode Island, including 47,000 children. 1 in 4 Rhode Islanders today is going hungry, and many of those individuals are SNAP incentives. Many of those individuals are SNAP recipients. This bill has the potential to really positively impact the health and well-being of people who shop with SNAP. I also want to note that
you have
sugary
another 30
drinks.
seconds, please.
Thank you. I'd also like to note that sugary drinks taxes are very effective ways to reduce sugary drink consumption. We know that when we tax sugary drinks, that people switch to water. I also want to note that our state has alarmingly high rates of diabetes and obesity. These things are strongly influenced by the beverage industry's predatory marketing practices, which deliberately target people of color. This is an opportune time to adopt a bill and legislation that would blunt the impacts of sugary drinks on low-income folks and people and communities of color. 42, I'll stop now.
Yeah.
42, I want to urge everyone to vote in favor of this bill. 42 countries around the world and 6 major metropolitan areas across the United States have adopted similar legislation. And just in closing, I want to encourage the legislators to think about how many SNAP recipients live in your districts, how many children and how many elderly individuals will benefit from legislation like this that promotes healthy eating and discourages sugary drink consumption.
Thank you for your testimony. You're welcome. Stay safe. Before we get to our next call, I'd just like to keep everyone abreast of where we are. We've gone through about 48 guests, but we still have several hundred more to go. So I want to, remind everyone. Well, I want to thank you for, watching the time and making sure that the other guests get a chance to speak. But I do want to remind everyone that if we're not done by 10:30 or so, and I'm not sure that we will be with the number that we have left, that we may have to go over into another day. That is why we tried to bundle the bills like we did. So thank you for making sure we stay on track with the less than 2 minutes. I know it's quick, but it's the only way we can get everyone in. And if we do have to have another meeting to finish the others, then we'll do that as soon as we possibly can, and everyone will be known. Okay? So I'll keep you abreast as we go, but we still have another couple of hundred people we have to get to. Okay? Next caller, please. Welcome. Is your television on?
No, it's not. It's just my phone.
Okay. Well, you're on House Finance now, but you have less than 2 minutes, please, to give us your name and testimony. So please, I'll go ahead.
Yes, my name is Mario Bueno, and I'm the Executive Director of Progreso Latino. It's a community-based organization in Central Falls, and we're in support of the legislation. I think we all know what's happening in terms of obesity rates amongst young people, especially Latinos and people of color, and this would really make an impact.
Thank you for your testimony. I appreciate that.
Thank you. And we look forward to getting a favorable outcome, and we look forward for this legislation to pass, especially because the SNAP incentive program will help low-income families to have further access to vegetables and fruits.
Thank you very much. Have a good evening.
Thank you very much.
Welcome. You're on House Finance. You have less than 2 minutes, please, to give us your name, testimony, so please proceed.
Great. Thank you very much. My name is Ashish John. I'm the Dean of the School of Public Health at Brown University, and I am honored to be here in front of all of you today. I'm here to talk very briefly about this bill and why I think it is has a lot of potential to have a real substantial health benefit for people of Rhode Island. As you all know, the bill has several components that are, I think, each essential. One is by providing a financial incentives for people on the SNAP program to purchase more nutritious fruits and vegetables, which, as all of you are aware, can often be much more expensive and can represent a real financial barrier for people of lower financial means. This bill provides a financial incentive for people to purchase healthier, more nutritious foods. It is funded by a tax on sugary beverages. Now, the 1.5 cents per ounce tax, I believe, is an appropriate amount. It will discourage the consumption of sugary beverages, but not make it so financially untenable as to be excessive. One of the questions that's been raised is why tax sugary beverages as opposed to other potentially unhealthy foods? And that's because there is very clear evidence that sugary beverages are probably the biggest contributor, certainly one of the biggest contributors to obesity, particularly among children. And very good evidence from Philadelphia, from other cities, other nations, that taxing sugary beverages substantially reduces the impact on poor people. So I believe this bill would have substantial health benefits for people, and that's why I'm supporting it. And I want to thank you all for the opportunity to speak in front of you today.
Thank you very much for your expertise. Keep up the good work and stay safe.
Thank you very much.
Welcome. You're on House Finance. You have less than 2 minutes, please, to give us your name and testimony, so please proceed.
Thank you. Thank you, Chairman Abney and members of the committee, for the opportunity to testify this evening. I am speaking today on behalf of Urban Greens Co-op Market in strong support of H5175. Urban Greens is a community-owned co-op grocery store with over 2,900 members and owners. We are located on the west end, south side of Providence. We serve a wide variety of customers that reflect the diverse communities of Rhode Island. While there are many voices weighing in on this bill, I have yet to hear anyone testify to the merits and health benefits of drinking sugary beverages. Quite the opposite. So I will lend my voice to what I know: grocery store operations, building sales and profits, customer retention, and creating meaningful job opportunities. I have over 4 decades of experience in this industry and over 2 decades as general manager. From the grocery store's perspective, the greatest economic impact of this bill is that it incentivizes produce sales. This is one of the departments where we experience our most significant losses. Increased produce sales reduces losses and improves profitability. That leads to job security, not job loss. For some in my industry are suggesting that Rhode Islanders will drive to Seekonk or South Attleboro to do their shopping because they won't want to pay the sugary beverage tax for their Coke or Pepsi. Setting aside that most Rhode Islanders pack a lunch when traveling from Providence to Cranston, supermarkets build loyalty and customer retention by offering high-quality, fresh products. I have never had anyone tell me that they love shopping at a store because they have great Dr. Pepper. I have heard plenty of customers say that they shop somewhere because they have great produce or great meat. Think about when you like to shop and where you like to shop. And success in our industry always begins with the customer and acting in their best interests. If this bill passes, it could increase grocery store produce sales by $20 to $30 million. Some people will object to a tax on sugary beverages, just as some objected to placing taxes on cigarettes. I get it. There are many similarities between these two products. In the end, our leaders made the right decision. I urge you to support H5715 for the positive impact it will have on our public health and on the Rhode Island grocery industry. Thank you for the opportunity to speak, and I would be glad to answer any questions. And I neglected to say my name in the beginning. It is John Santos, and I'm the General Manager at Urban Greens.
Thank you for your testimony, John. It's always very important. We consider everybody's testimony, and this is very helpful. But thank you. Stay safe, please.
Thank you, sir. Thank you. Have a good evening.
Have a great one yourself. Welcome. You are on House Finance. You have less than 2 minutes, please, to give us your name and testimony, so please proceed.
Thank you, Chairman Abney and member of the committee. My name is Renelli Espinoza, and I'm testifying in support of House Bill 5715. Thank you for hearing my testimony today. I'm here to support this initiative because my SNAP benefits usually aren't enough to last throughout the month, and it's really hard to budget and eat healthy because fresh fruits and vegetables are really expensive, and I can't always budget them. I'm 47 years old. I have high blood pressure and asthma, and a healthy diet rich in fruits and vegetables is very important to me and my family to maintain our health. I have 3 grandbabies, and feeding them fresh fruits and vegetables are very important for them to eat. Also, bottled water is expensive as the unhealthy sodas. And how would I form a from a program like this would be allowed to receive 50% off my fresh and vegetable purchases when I pay with my SNAP benefit, would greatly improve the quality of my diet for me and my family.
Thank you very much for your testimony. It was very important to us. Stay safe and have a great evening.
You too, and thank you very much.
Uh-huh. Welcome. You're on House Finance. You have less than 2 minutes, please, to give us your name, testimony, so please proceed.
Good evening. Thank you so much. My name is Dr. Philip Chan. I am a community physician, chief medical officer of Open Door Health, also an associate professor at Brown University in the Department of Medicine and School of Public Health. I'm here today testifying in my capacity as a public health and clinical physician. I want to first start off and just say that I've dedicated my career to public health practice and addressing health disparities, as well as the clinical care of underserved communities. And that is why I'm here tonight testifying in support of House Bill 5715. This bill is going to go a long way to promoting public health and healthy eating habits for all Rhode Islanders, and especially Rhode Islanders from lower socioeconomic backgrounds, many of whom are struggling right now. I have been quite alarmed with how our childhood obesity rates have risen in recent years in Rhode Island. And I was quite surprised to actually learn this past month that we are now ranked 11th for childhood obesity here in the state of Rhode Island, 11th. And due to the marketing practices and tactics of the beverage industry, sugary beverages are more commonly consumed by low-income families and families of color, which are contributing to the high rates of chronic diseases such as diabetes, which are more prevalent in these groups. And as has been mentioned in places, cities, towns, states, other countries around the world that have implemented a sugary beverage tax, this has led, of course, to less sugary beverage, such as soda. Furthermore, and I think importantly, as has also been pointed out, the proceeds from this tax will be used to increase SNAP incentives in grocery stores. So this bill is really a win-win on multiple levels, especially by addressing and improving the health of those who are most at need in Rhode Island. And on a personal note, I'm going to end on this. As a parent of a 10 and a 13-year-old here in the town of Lincoln, I would never want my children to be targets for predatory marketing by the beverage industry or to consume such a large quantity of sugar. There's no question in my mind that this bill would go a long way in promoting the health of Rhode Islanders. So again, I enthusiastically support House Bill 5715. Thank you all, and have a good night.
Thank you, Dr. Chan, for your testimony. Take good care of yourself and stay safe, please. Welcome, you're on House Finance. You've got less than 2 minutes, please, to give us your name and testimony, so please proceed.
Good evening, Mr. Chairman. Carolyn Murray, representing the Rhode Island Beverage Association, the trade association that represents the non-alcoholic beverage industry in Rhode Island. Our industry employs more than 600 workers in Rhode Island and pays more than $41 million in wages annually. Our members include Coca-Cola Beverages Northeast in Providence, Pepsi Bottling Group in Cranston, Nestle Waters North America, Keurig Dr. Pepper, and Polar Beverages. On behalf of the association, we oppose H5715. It's very important to know that this is not just a soda tax. This tax would increase prices of sports drinks, juice drinks, iced tea, coffee drinks, lemonades, energy drinks, and flavored waters. It will also tax coffee milk syrup, the official state beverage. It's hard to understand why one item in your shopping basket would be deemed unhealthy and therefore assessed a sin tax. This proposed tax will hit all of us, but the hardest hit will be the restaurants and small businesses that survived COVID. Restaurants and convenience stores that serve fountain drinks would see the 5-gallon syrup bag taxed an additional $57.60 on an approximate $100 item. This bill is written so that the tax is mandated to be passed on to the consumer. Again, the folks who can least afford this will be affected. I encourage you to look at the changes in the beverage aisle today. There are more choices and smaller portions being offered than ever before to help consumers reduce their sugar calories. I've provided written testimony with more detail about the bold actions and initiatives that the leading beverage companies are working on to reduce sugar people get from their beverages. In closing, I ask that you support the local beverage companies, grocery stores, convenience stores, and restaurants, and please do not support H5715. Thank you.
Thank you very much for your testimony. Please stay safe out there.
Thanks, Chairman.